For everyone with an interest in NASH, or more broadly, fatty liver disease, Surf's Up, Season 4, Episode 16 of Surfing the NASH Tsunami. Our preview of June's upcoming International NASH Day from Global Liver Institute starts now.
This week on Surfing the NASH Tsunami.
This year, NASH Day is in the context of an incredible series of activities. There's no such thing as a finish line in medicine.
We know that coffee is good for the liver. I think it's the year of caffeine, frankly, because a lot is going to happen, and I think we all have to actively participate and support these efforts.
There's a higher incidence of non-alcoholic fatty liver disease among family members, and this is just so incredibly useful by asking simple questions. Have you thought about your brother? He might be at risk for advanced liver disease.
So my challenge to everybody around this event and that theme would be to ask, what can you personally do to step up?
Every week, a global community of fatty liver disease stakeholders comes together to explore the most important challenges in diagnosing, treating, and developing medications for patients with fatty liver diseases. Join hepatology researcher and key opinion leader Professor Jörn Schattenberg, pricing and forecasting guru Roger Green, and their guests, Global Liver Institute founder and CEO, Donna Cryer, and Terns Pharmaceuticals Senior Vice President Pam Danagher, as they preview GLI's upcoming International NASH Day and discuss why it means so much in 2023 on Surfing the NASH Tsunami.
First of all, welcome everybody. This was that 1 year in 33 when Passover, Easter, and Ramadan all come at the same time. So happy Easter, happy Passover, Ramadan Kareem, and hopefully everybody has had a good celebration of their holidays. Today, we are talking about an international event, which is one of the reasons I start by mentioning the serendipity of all those holidays together. And we have with us Jörn. Hey, Jörn, how are you today?
Hey, Roger, I'm fine. It's a bank holiday today, still related to the Easter weekend. So I had a great day.
Excellent. And we have Donna with us, and Donna and I have both chosen to show up informally and in baseball caps, or some kind of cap. That's actually more of a camo cap. Yeah. Donna, how are you doing?
I'm doing well. I, too, was taking a bank holiday in the spirit of being a global organization.
I heard you're taking a bank holiday week, actually.
I am. I'm going to try to meditate on my life's choices, see how I can make sure that I am centered for all the things that we have to come in the next few weeks and months.
And we will start chatting on some of that in about 2 minutes, as soon as we say hi to Pam Danagher. Hi, Pam. How are you doing today?
Hi, Roger. Hi, all. Very well, thanks. Glad to be here.
Happy to have you with us, Pam. I know we did a one-on-one interview as part of an episode earlier this year. I believe this is the first time you've ever been part of a panel. Do I have that right?
Yeah, I think the first time it was just the three of us, yourself, Jörn, and I.
So happy to have you. So with that, because we don't have a ton of time, given that we're on bank holidays and Halloween weeks and all that good stuff, why don't we just dive right into icebreakers? One good thing that's happened in your life in the past week, personal or professional. Brave one, go first.
I had a chance to spend time with my mom yesterday for Easter. And as she pronounced it, it was quality time. So if mom is happy, I'm happy.
That's fantastic. And you look happy. It's a good thing. Next.
Family quality time was for me on the agenda too. And additionally, I was doing the wards last week. So exciting clinical stuff and happy to support and help patients. So it was a fun week.
All right, Pam.
I'll pick up the same thread of family quality time. Had a chance to visit with my oldest in New York City, who is working at an art gallery. And so it was a wonderful get together. And also we have beautiful spring weather here in California, so always brings a smile to everybody's face today.
The weather's gorgeous. The flowers are out. So I'm going to do what might be my thing you wouldn't know about me if you didn't guess it reveal, which is that yesterday, for fun, I went to an Easter party dressed as the Easter Bunny. Probably not something people who are Jewish do frequently, but it just felt like the right idea. I knew no one else was going to do it, and it worked out really well.
Too bad you're not wearing your Easter Bunny hat right now.
Well, it wasn't the hat; it was the whole outfit, and the ears were floppy. And then, by the way, I got to go show my granddaughter, who's not being raised Jewish, that her G can be the Easter Bunny, and she thought that was really exciting. So, the look on the face of a 4 or 5 year old kid when you, as you know, when you share something like that with him is just really spectacular.
When you show up as Easter Bunny, I should.
Yeah, you should do that sometime. And off we go. So we scheduled this episode because I speak frequently with Donna and actually more frequently these days with Jeff McIntyre. But the idea being that this is a really important year for NASH, and that makes this a really important year for International NASH NASH Day. Normally, we preview this episode closer to the day when we simply try to get people to listen to our podcast or to listen to the event. But we're doing this earlier because we'd like to help motivate organizations that listen to this podcast to think about how they can be part of this day, which starts with why it's so important this year. So we have Pam from Terns, which is a company that's worked with GLI over time. And we have Donna, obviously, who founded GLI.
Since you shouted out to me over the podcast, was that to test to see if I was listening, if I was a devoted listener? I am. And so when you made reference in previous podcasts, I hope Donna Cryer hears this. I heard it. I answered the call. So I'm here today, even on my day off. So you got me. On
your bank holiday week, huh? Okay. This actually started with a conversation you and I had about why 2023 is such a big deal. So why don't you take a few minutes and walk through some of the things that you folks have identified that you think are so pivotal in the year?
Sure. I think that over the course of doing International NASH Day, or hashtag NASH Day, as my team likes to call it, to make sure that we are relevant across social media, I think that the exciting part is that it's really owned by the community. That was my ask from the initial founders of this, that for it to grow in the way that it would need to grow to really match the prevalence and the seriousness and the urgency of this challenge of fatty liver disease and NASH, that we would need all hands on deck. We would need every patient advocacy organization, every medical society, every industry partner, all on the same footing, all able to come together and to express support of what we're doing across the entire field of NASH and how GLI has convened it. It's really less about the template or the form or even the theme that we put out, and I'll share that shortly, but it's really about facilitating and catalyzing every community to be able to find what fatty liver disease and NASH means to them. And so over the course of the past, 6 years, we have seen communities really embrace this, whether that means bicycle races in India, or if it means town hall meetings with outreach to women's groups in Cameroon, Africa, or whether it means educational events with screenings at academic medical centers in the U.S. And of course, we love all the groups of nurses and doctors and physician practices who wear the yellow and green. The one time I allow people to not wear burgundy, but either yellow and green, or hopefully this year, the official NASH Day t-shirts that we do have available, and just pose. I think that it cannot be underestimated, the solidarity, the motivation, that solidarity that post each event, each activity gives to patients with fatty liver disease and NASH who have felt so isolated and overlooked. And so the feedback I get every year from people, whether patients or caregivers who are living with NASH, is just really such a heartfelt appreciation for the attention. They certainly benefit from the educational content and the way that they understand we're moving the field forward a bit every year. But just the fact that for one day they feel the full light, they feel like they can step into the light, and then the attention, positive attention, is on them. It's an incredible gift that we give to patients and families, and I hope it motivates everyone in the community to see how we've grown, to see the strength that we do have. And so each year as International NASH Day becomes more inclusive and the geographic outreach spreads, it becomes more impactful for the field. And I couldn't be more proud to sort of be at the center of that and to help that to continue to scale.
So staying in the tradition of the multiple religious holidays, I'll go to the one I know best, and the Passover Seder starts with a question that goes, why is this night different from all other nights? Let me just transpose briefly and ask, what about this year makes it different than all previous years?
Well, I think this year NASH Day is in the context of an incredible series of activities. There's no such thing as a finish line in medicine, but there are certain milestones. And we are in the context of quite a few regulatory events that people are training for. I feel it every time I go to the gym. I'm training for this year, whether it is the upcoming ICER meetings or the OCA AdCom or future AdComs that may have this year for the amount of communications and educational materials to a wider variety of stakeholders that we will have to go to this year. So NASH Day, hopefully being in the center and swirl of activities that will include the approval of the first drug with an indication for NASH, takes on a special air of anticipation.
Okay, so let me invite Jörn or Pam to ask questions or make comments before I go on.
Just a quick comment. I feel the anticipation Donna is mentioning too. It's that bristling air where you can feel the tension is high and we're close to getting drugs approved. And thinking back of NASH, I think first one was run in 2018. I remember we put up a booth in downtown and handed out little flushy livers to educate about a silent organ pretty much. And I think that type of outreach, as Donna said it, each community by itself decides what's feasible. How can I reach someone that will then think about the liver at least once, or somebody who works with liver all the time, kind of expanding their outreach. I think that's the unique constellation. And when GLI stepped in to carry this forward, I was very pleased to have it, neutral, no commercial financial interest driving this, and really being able to move the day forward and just do things. So I've been involved in a number of them. The one with the booth in the downtown, I want to repeat this. I'm not sure I'm going to get to do it this year, but I want to do this again at one time and hand out little leaflets. And
well, whatever support you need to do it, we will do it. We'll send Giacomo over to set it up. But yeah, we want to leave no institution, no city behind that has an interest in doing a NASH Day event. I was really touched last year that Manal Abdulmalik told me how, newly arrived at Mayo, she wanted to be a part of NASH Day. And so she was on a chair or a ladder or something trying to put up NASH Day posters herself. So the janitorial staff quickly came to her aid, but also started asking questions about, well, what is this? And she was able to start educating, even from that position. That it is in the can-do spirit of NASH Day. We're going to give her a lot more support this year. And I know she has a fantastic event, has invited Mary Ranella, world renowned, of course, to partner with her on that event. So we are able to support her much more fully in that event. So we offer the same to you.
I'm thinking the video of Manal educating janitorial staff while standing on a ladder could have been part of the permanent collection.
I wish there was a photo of that. I think it may have inspired, even subliminally, this year's theme, which is Step Up to NASH. So she was certainly stepping up in a very real way on that ladder to make sure that her institution wasn't left out of this awareness opportunity. And so we're asking everyone to step up to NASH. One of the ways that people can do that, and as you know, through our NASH action plan, we make sure that everybody has an action that they can take, whether they're an insurance company, an employer, a pharmaceutical company, an academic clinic, a support group that wants to come together, or really anybody. I know as my personal trainer makes me do a lot of steps. So we'll film sometime very soon in the gym steps. But we've also thought about there's some iconic steps around the world, certainly here in DC, near the monuments, or in Italy, or in Los Angeles, steps that people run up every day. We're going to be putting together, as part of our social media toolkit, calls for people to send us photos or videos of them stepping up to NASH on some of these iconic steps around the world. That is just one part of the sort of the visual theme of this.
So to be a local complete homer, before we turn to Pam, have you got a group of people running up the Rocky Steps at the Philadelphia Museum, or do I need to do that and organize friends to do it with me?
I think you need to lead that group, but that's exactly the type of thing that we were thinking of. So yes, claim the iconic steps in your city, get a group of folks together. We hope to have some groups of school children and other things. As we know, pediatric NASH is also an issue. So this is a way that anybody can be involved.
That sounds like an activity. Let me see who I can find and what I can do. And I'm sure you know who you have in Philadelphia who can help me. That's great. And,
I do. I may send you a daughter or something of mine.
That'll work. Excellent. Pam?
Well, I want to volunteer to lead a field trip to the Spanish Steps in Rome, because that's one of my favorite places. And then we can go for a lovely meal afterward. Just to add on to these comments, as Donna said very nicely, it takes a village. Donna, you mentioned a lot of the key parties. This really is going to be a huge year for NASH, with the anticipated advisory committee for the first product on the 19th of May. Having a product approval will be a watershed moment for the industry, for the community, for patients. And I think we'll see a number of developments from there. And I think think we have seen in other therapeutic areas where products become available in an area where there weren't available therapies. It's just a game changer. So I think this really is very exciting, and really looking forward to this year and running up the steps, I guess, Donna, right?
Excellent. I look forward to it. I'll tell the team to hold a spot for it. I think as the team gets ready and we reach out to our community partners and our fabulous nursing and physician partners for ideas and ways that we can be ever more relevant, it's a really useful educational aspect to keep us as an organization, as GLI, very grounded in what does the community need? What are the challenges and barriers to best practice care in NASH in differently resourced environments? We see some place where there are free screenings available. When we went out to visit our friend Naima Corey at Arizona Liver Health, and there are people who aren't aware of that. And so how can we change that? Because the only barrier is people knowing about it. And in other places, there are barriers of mistrust or barriers of different types of physician groups or nursing groups that we've been reaching out to more often, who've sort of heard about this fatty liver disease thing, but are not sure what they should be doing about it right now in the context of organizing NASH Day. It really is sort of NASH 365. We are involved and figuring out ways that we can make this relatable and relevant to every population of people. One of the exercises that we go through is, what languages do we need to have NASH materials in? We'd love to be able to have them in every possible language. And frankly, our website does have Google Translate, so you can sort of do that. But we've added Vietnamese and Tagalog for this year, and my sister-in-law is going to be taking a batch of materials to the Philippines. It's really thinking how we can better understand and better meet community needs and illustrating that through NASH Day. So while it's a celebration always, I think of it too as a way that we can, particularly in the panels that we do on the state of NASH or highlighting issues of pediatric NASH or NASH in Hispanic or African American communities, or when we get global advocates together. I hope people listen to those with an ear towards, okay, here's an issue. Can I step up to help solve that issue? So that at next year's NASH Day, we're reporting out on how we've come further, on how partners who were only able to do a small event can do a larger event, on people who were early in their advocacy have now got an organization around them. When I see the growth of NASH Knowledge, which incubated out of our Advanced Advocacy Academy, and everything that they're doing, not just for Pittsburgh, but that they have hundreds of patients that they now provide peer support for. That's sort of the legacy of NASH Day. So after the banners come down, social media graphics, the analytics calm a little bit, what happens after is even more important. And so as we've grown as an organization to be able to support people throughout the year, it makes each NASH Day more exciting, because then we're able to report on actual results, actual growth, where we've had traction in bringing NASH messages to places that they weren't before, or now commonly included in places where we were ignored before. And so that's what's exciting too at this point, to be able to see the traction, to see the things that frankly people can assume will happen now, where there wasn't advocacy before to assure that the things would happen. And so that's exciting. But we do need everybody.
Donna, you mentioned the social media campaigns and the hashtag NASH Day, which I think is one of the big things. It has grown over the last years. And even if that's short-lived, I think by reaching so many over social media, you really create something enduring, even through those channels. And I mean, the reach is obviously much more than we can get in several locations by putting up signs and booths. So really your team driving that social media presence of NASH Day, I think is one of the big advantages too. And the reason why it reaches so many parts of the world. So to me, that's a big thing.
They continue to, I love that my team is competitive. How could they not be? They work for me. And And the communications team alone speaks 5 languages. And so they're always challenging themselves. Can they put, graphics in different languages? Can they reach out to new places and support them with materials? How many impressions? Last year it was 11.5 million NASH Day impressions on social media. So I know that they want to exceed themselves. We are already have exceeded the number of medical society and other endorsers. We've added the World Obesity Federation and both associations from Costa Rica and Cuba. This really has an opportunity to unite the whole world around NASH.
Because I hang out with lawyers, I've always been told never ask a question you don't know the answer, and occasionally I violate that. Can you point to one thing maybe that happened last year that's had ripples in the pond of liver disease that came out of NASH Day 2022 that will stimulate people as to how to think about what they can do this year and what might come out of that?
Yeah, absolutely. We gave over $100,000 in community grants to support organizations to be able to put on events and participate. As we saw first, maybe a speaker involved in international NASH Day panels in India, to event in the medical societies, to then a larger scale community events, to an Indian NASH action plan. So I think the growth of something like that over time is a great example. We're seeing that with some of our African partners as well. Then a very small seed grant has allowed them to not only do education in NASH, but start to partner with other organizations. And then they've been able, it has affected their ability to do hepatitis B advocacy and really energized and facilitated the capacity to do liver health as a whole. That's really exciting. And so as we look at the results of NASH Day and which of our community partners, either inside the US or outside, really sort of take this and run with it, that allows us to understand how we can really select partners to invest in, to have community impact, and to share best practices from. So it's a little bit of a learning laboratory as well to see what community activities really take off and we can share with others. We certainly saw that with the ability to do NASH clinical trial recruitment as part of an event in our San Diego chapter. And so looking at that and sharing with the other Liver Action Network members, this is how you can add that aspect to your events, because they found 26 patients in a day. So I think that makes them/us the best CRO in NASH, just saying. But how can we scale that so that other partners can do similarly? So I think those are some of the results that come out of NASH Day when we really dig deep and try to understand, what worked on that day.
So before I monopolize all the questions, anybody have any other questions or comments right now?
Maybe just to reflect on, the discussion around clinical trial recruitment, I think something important for the future is going to be continued drug development post-approval of hopefully 2 new therapies for the treatment of NASH. And so I think that's something where, again, it'll take a village going forward. Maybe we'll use some of those CRO services going forward, Donna.
I remember having a conversation with Rohit Lumba about the untapped potential of the liver community, liver patient community, certainly our Liver Action Network, for clinical trial recruitment. And I make that statement having built a multicultural division for a clinical trial recruitment firm. The patient community recognizes how different all of our experiences are with fatty liver disease and NASH, and understands that we will likely need more than one type of medication with more than one mechanism of action when all is said and done, to be able to either have enough of a size effect for some people, or just because people have different concurrent conditions and that people are so different. And so I think the patient community understands that and has always understood that. One of the lasting effects of this NASH Day is the work that we're doing with our Liver Action Networks to reach out to primary care physicians in their communities, the relationship that we've been building with the gastroenterology, hepatology, advanced practice providers. And so getting NPs and PAs aligning with their regional meetings and doing activities, making sure that they know who are the the endocrinologists in their communities, not just the gastroenterologists, and really building out a larger, broader set of partnerships than they may have had before. That will really be the key to just being successful in this spread of liver health information, but is particularly vital to being able to ensure that there is a continuing source of appropriate patients for NASH clinical trials for years to come. We know that all the patients aren't currently in clinical trials. They aren't currently connected to care, sitting waiting. It's not like Hep C, where there were patients who are, warehoused, so to speak, with all of their doctors carefully saying to them, well, hold on, wait a minute. We're right at the precipice and ready to give them hepatitis C treatment in many cases the moment that this comes out. We know that's not the case in NASH. So a consistent effort to reach out and identify patients and give them an understanding of where they are in their fatty liver disease and NASH journey, and to connect them to appropriate care, whether that's medication or not. But these relationships that come out of doing NASH Day events with a larger community focus will enable us to identify a larger number of patients, hopefully for years to come.
I mean, I fully agree with the untapped potential you mentioned, Donna, and by the energy we can set free with these type of events, but also through GLI, of course, and motivate patients to take care and control of their liver condition and ask themselves about their liver health. So one of the slow aspects of the drug development process was to get the right patients to the right centers that are participating in the trials. And I think, it's the extent of outreach that GLI and you have been doing that really helped us on this.
Thanks, Jörn. Don, a couple more questions. First of all, you do some fantastic panels every year around the event. It may be premature to talk about those. I don't know where you're at on the planning for the panels, but is there anything coming up this year that people should really be excited about that you can talk about yet?
I enjoy the Global State of NASH panel as much as anybody else. And although there is a proliferation of NASH meetings and sharing of NASH, of once a year coming together and being asked to explain where we are as a field in language that real people can understand is a good exercise for everyone to have, and a place where we can tie up some of the different threads in medications and devices and non-invasive diagnostics in one place and available as an enduring material on YouTube for folks. I also enjoy that there are partners who come to us, such as the Association of Black Gastroenterologists and Hepatologists, who want to make sure that they have a panel that they are leading and putting together. And so that's really exciting to me, that there's so much enthusiasm for people asking to be a part. We'll also be doing a panel on pediatric NASH, to be sure, coming out of our parents and pregnant people events in our pediatric and rare disease month, which results were, just really astronomical. There have been so many new partnerships, whether with mommy groups or pediatric medical societies, that we want to make sure that energy is shared in the NASH space as well. But one of the things that we have been doing, and hopefully I'll be able to squeeze a little more in, is we've sort of taken NASH on the road. And so we shot some footage in Arizona and got a little bit of what a day in the life, or at least like what a NASH patient visit would look like. I did get a FibroScan. We may reveal those results as part of it. And so rather than having people coming in to a panel, we're going to try to go out as much as possible and film on the road in the environments, in the research centers, and the doctor's offices, and the clinics, and the clinical trial sites that people have now that the world has opened back up. So we hope to do more of those.
Is there anything you've not mentioned yet, any particular thing that people should be excited about or look forward to?
There's one thing that I really want us as a community to dig really deep in, and that is for both our industry partners and for just companies, large employers in the community. We'll be creating particular toolkits with table tents and presentations for people to show their employees. And so we're reaching out to HR and benefits people, because we realize that even within companies that are in the NASH space or in the liver cancer space, or often their board, their C-suite, particularly in companies that liver disease is not their only area of focus, that there's a lot to do within all of these companies as employers to raise awareness about NASH. And I think that we would be remiss if we didn't really dig in and pay attention and give a robust effort to ensure that everyone, large companies, certainly every company that it touches the liver space, has the tools to do employee events, including screenings, but definitely including, education and opportunities to give. But that employees, these are people. We know people have NASH. People have family members that have NASH. If we can't even talk to the thousands of people that we work with every day, we would have missed an opportunity. So my hope amongst the plethora of Step Up videos, that employers will step up and really take this message to their employees.
Again, I think many things that Donna has highlighted, and I'll hand it over to Pam to detail the company's perspective, is that intensity by which we approach the people living out there and reaching out to them. The example Donna mentioned is through the families. And we know that there is a higher incidence of non-alcoholic fatty liver disease among family members. A, they share the same diet and environment, and B, they share common genes in most cases. And this is just so incredibly useful by asking simple questions. Have you thought about your brother? He might be at risk for advanced liver disease. And that's a good idea. Maybe we should bring him next time. And this type of amplification or of the health methods we want to portray here, again, that's to me the big thing about NASH Day. #NASH Day.
#NASH Day. I also think that, Jörn, I also listen for tips on format for our materials. I kid my young team members about putting things in millennial font. I was like, can I have this in a size that people over 50 can read? But I think that you give me ideas for some tear-off sheets or something that there is a portion that you can have for yourself, but maybe something that you hand off to your brother, your sister, a family member, or able to share socially as well. But something that spurs a family conversation or referral, if you will, I think would be an important aspect. And so let me get with my Cracker Jack graphics folks and see what they think about that.
Particularly tear us for the booth in the middle of Mainz, huh?
Yeah.
Jörn, you might have to go do this. I might have to run the steps. You might have to do a booth. Pam, what are you going to have to do?
I think, we've raised a number of important points here just from a sort of general public health point of view. Healthy diet, concern about food deserts in certain places, particularly in the U.S. And Donna, you've touched on maybe more routine screening, certainly in high-risk settings, as Jörn has raised. But, you wonder about some of the efforts around developing non-invasive tests that can be used in the first instance to support drug development in NASH, for example, to assist diagnosis for trial entry, and then potentially even for an efficacy assessment at the completion of a trial. But, could you envision a future where there's some simple non-invasive test that, that's just part of your routine screening, right? You go for your, yearly checkup and you're going to have certain things evaluated. And is there a future where there's some simple non-invasive, right? I mean, I don't think anybody wants to sign up for another colonoscopy, for example, but something a little less invasive maybe might be something on the horizon in the future.
I think that there's incredible potential in serum-based tests so that it's just part of your normal blood work. But I would still caution us that right now, a lot of doctors don't pay attention to elevated liver enzymes. And so we need education and maybe facilitation in the order sets or to get them to order the test and to interpret them. Again, communicate that information back to patients. So there's some wraparound activities to even something that seems so simple. I also think that I'd love to have a van with FibroScan in it and be able to do rapid ACV testing and hepatitis B testing and just a liver health van and able to do some FibroScan in it. So Roger, you shouted out to me. Let me shout out to EchoSense about our interest in really bringing, liver health screenings out to communities and integrating this into community health fairs like other types of testing are, and really make it hard for people to avoid. I want to go beyond easy for people to reach and make it hard for people to avoid liver health screening. We need, there's a lot that we can do to bring this to people that we can continue on. That is the continual challenge beyond NASH Day. But I hope we can give some great examples of that on NASH Day to show.
You make an interesting point. And when I heard the theme being Step Up to NASH, one of the things I thought about is that we haven't really been pushed to do that because in the absence of drugs, lots of people just aren't going to pay the attention they need to. If, as we all hope, drugs become approved, then we're all going to have to step our games up because we're going to have patients who want to do more done, doctors who want to do more. We'll start to see advertising from drug companies that will force everybody to become more knowledgeable. We're going to have a whole bunch of patients fall through the cracks in horrible ways that haven't happened yet. So my challenge to everybody around this event and that theme would be to ask, what can you personally do to step up? Once I get to the top of the Rocky statue and I catch my breath again, what can each of us do really to step up our game so that we help educate consumers so that when they hear from their doctor, you've got fat on your liver but nothing to worry about, that they convert themselves into activists and patients instead of just going away and saying, okay, that's fine. And then hearing 20 years ago, like a Terry Milton or a Tony Vigliotti or a Wayne Eskridge, that you have to have a liver transplant because we never told you at the time. But, like half the people who've learned for the first time when they're decompensating in an emergency department. The theme is really fantastic. And the call to everyone to step their games up is really important. And I just wonder if we missed anything on that before we let you go. You're 2 minutes past when you said you had to be out of here.
Donna's leaving soon, so I'm going to shout out to her with a second idea. And we still need the celebrity. I think we've discussed that idea sometimes. We need somebody who steps up and says, I'm affected. Somebody who has a broad reach to the public. And if anybody, you can find it, Donna. So we'll him or her.
I am actively asking. I think, frankly, that is one of the things that having a drug on the market and companies, our industry partners can help me do. GLI does not have a celebrity budget, but we can make this a safe, destigmatized place for a public person, a well-known person to come and join us. I think that we certainly know that there are well-known people who do have NASH, who must have NASH. I'm sure there are many ASLD members whose patients they are. So I would turn this around and ask, or EASL members, so I would ask the physicians, are you talking to your celebrity patients and encouraging them to step up, knowing that my team at GLI and I'm sure other advocacy organizations would treat them well, would treat them with respect, would cheer for them and counter any negative. I dare somebody to say something negative about a celebrity who comes and steps on board for GLI. Bernie Williams has been a fantastic, legendary baseball player, has helped us in liver cancer to great acclaim from his community, all of his communities, music and baseball and sports. And so I think we have, with that demonstration, if nothing else, people should come on board. Liver patients deserve to have somebody to stand with them the same as other patients. We are wonderful, wonderful people. And so we would welcome a celebrity in our midst.
Looking for a celebrity to step up, huh?
Yes, we're looking for a celebrity to step up.
So we got companies that need to step up, celebrities that need to step up. Before you go, anyone else that needs to step up besides like the world at large?
Oh, yes. My goodness. But that's why I took this week off. So I would breathe and maybe in a calmer tone tell a few people how they could step up, particularly those who make comparisons to other advocacy communities without appreciating all that the liver advocates have done. So if anybody wants to step up to support the visibility and viability of this community, we welcome them.
As you know, we first had you on for our 9th episode almost 3 years ago, 174 episodes ago, to talk about International NASH Day. So we're just waiting to hear what the call is for us this year. Happy to do whatever you need us to do.
You have it. Step up.
Okay. Step up. Okay. Donna, thanks. I'm going to let you go. Keep these guys for another couple of minutes. Okay. Take care. And have a week of peace and harmony so you can ask people to step up big time.
Bye, Donna.
Bye.
Bye, Donna.
So that's interesting, right? Can either one of you think of step-ups that people can be taking right now that don't readily come to mind or that you're thinking about now as we talk about it?
So the one step up that resonated with me is that NASH Day is always faster around the corner than I'm anticipating it. So it's just 2 months away now. So the question is, what will we do hands-on? For my center, that's always the big question. The step-ups in terms of, I think, the big thing is also about engaging, and Donna didn't discuss this, engaging the professional societies, ASLD and EASL, getting their support, which is easier now with a patient organization-led event. And beyond that, even outside of the liver space a little bit, Donna mentioned the obesity arena. So I think it's important to get the buy-in on those ends.
I certainly agree with you about obesity. I think that's become a topic of more focus, and certainly the two are significantly intertwined. Pam, what can you see developmental drug companies doing, not just Terns, but everybody else? What does step up look like there from what you can see?
Sure. Thanks, Roger. I think of stepping up in terms of, from an industry point of view, how can we simplify? How can we streamline? Right now, the path to bringing products to market is lengthy. Are there opportunities to simplify things. I think we touched earlier in the discussion on leveraging non-invasive tests, for example. Is there a way to collaborate across facets of industry? So that might be diagnostic manufacturers and drug developers, for example, to work with the assistance and collaboration of the regulatory authorities toward drug development pathways that are simpler, faster, less invasive overall, and possibly minimize the need for any unnecessary biopsy, for example. I think, and that's just one example of how we may simplify things from an industry and a regulatory point of view. What are the opportunities? And I think some of those may become clear as we go through the regulatory process for the first couple of products that we hope will gain approval for the treatment of NASH, looking at that regulatory process, understanding the risk-benefit profile, the opportunities for those products, and are there gaps, for example, that remain unaddressed?
Excellent points. I had one thought I had over the last few minutes, Pam. We spent a lot of time last week. We reviewed the Liver Forum 14 meeting. We had Veronica Miller with us and Michelle Long from Novo Nordisk and Mazen and Jeff McIntyre. We spent some portion of that talking about the panel that you and Manal shared. And to me, part of the step up, one of the issues that keeps coming up to me over and over again, Scott Friedman talks about us being yoked to biopsy, which I've taken to calling the straitjacket of biopsy, because I just think in so many ways, the way we envision the future is so limited by biopsy in terms of the definition of what efficacy is, in terms of what life has been without clinical trials. And I think a big step up for everybody is going to be to take a bold and an expansive view of how the world is going to change and then anticipate.
I couldn't agree more, Roger. I think that's spot on. And, it was a very lively panel discussion, but I think a common thread really is the complexity of biopsy and the need to simplify and streamline, in an appropriate manner. So it won't be easy, but, the fact that things are difficult has never stopped us before.
Ken Kuzy is fond of saying, if you achieve your dreams, you didn't dream big enough. And I think that that's a point worth making here. Yes, I think biopsy will have a place going forward, but we need to conceptualize all that. The question that came up last week about what happens to drug trials once we have drugs in market? What happens to trial recruitment? What happens to protocols that exist? How are we going to use NITs differently? We're in a world where we can't possibly biopsy everybody that you might want to evaluate for a drug, even if, whatever's in the label or not. These are all huge questions. And my fear is that none of us will swing big enough on that.
Yeah, I think that's valid. And I think it also comes back to, as Donna said earlier, it really does take a village. It isn't just industry. It isn't just the regulators. It isn't just the clinical community. It's really, it's all those parties coming together.
Yes, it is. And in part because I've used this metaphor recently, NASH is a little bit like the blind people touching the elephant. Everybody touches it in a different place and it feels like a different thing. So the village is actually the totality of everybody touching every piece of that experience so that we can think in an integrated way about what do we actually have to do. And I think your point is dead on that. It does take a village. It takes a village to raise an elephant, but in this case, the elephant happens to be NASH. I couldn't agree with you more. So just closing thought, what's the energy that you hope in the places that you touch will come out of this day and this coming together of the community?
It is a big question. I think this is the year of NASH. There's no question about that. Also, we know that coffee is good for the liver. I think it's the year of caffeine, frankly, Roger, because a lot is going to happen, and I think we all have to actively participate and support these efforts. And that's, on the patient advocacy side, we heard very nicely from Donna about a number of initiatives. It's the regulatory authorities, it's the industry, it's the clinical community, and also even the health technology assessment bodies, the reimbursement and payer decisions around these products once approved. I think everybody has to be on point. Everybody has to be fully engaged and bringing their best game, honestly, to these in this year of NASH.
Yeah, so the comment on coffee is well taken, and it's been shown to be protective, but clearly we hope all for indication NASH to have something more than coffee after this year. So I think the reason we always highlight the coffee is because we never had a drug for NAFLD, but this is going to change, and the momentum that comes out of NASH Day leading up to discussions with the regulators and the interpretation of their response to these drug approvals is going to be crucial. We need to get more people involved. GLI and hashtag NASH Day, the International NASH Day, will be very supportive for that. And I'm just hoping we have a big stage and a broad, beyond the usual community, broad reach. And I think then mission accomplished if we get get there.
Totally agree with both those comments. And Pam, we're doing our third birthday celebration on the podcast next week, and coffee actually plays a significant role in that. Just to presage, Mike Wilson, who's our audio engineer, has something he calls his drinking game, which is phrases that he associates with different individuals. And we actually have a contest for listeners and everybody else. Send in the phrase you most associate with Jörn and with Louise and with me. We have a couple of other items that will contest. But the contest winners will each receive bags of a favorite coffee of mine, because I figure if you're going to play a drinking game in NASH, it really has to be with coffee. You can't play it with anything else, right? You can't play it with alcohol. So a coffee drinking game seems to me like an appropriate thing, and thank you for bringing that around. I didn't know that I was going to mention that this week, but it came up, so here we are. Pam, thank you so much for joining us. Jörn, thanks as always, and thanks for taking time out of your Easter Monday evening to do this. Much appreciated. Sure. I'll be back with Business Report in a few minutes, and we'll be back next week with the third birthday celebration. Keep your eyes out. We're doing advertising on that this week. We're going to have some fun. Bye-bye now, guys.
And now for the Season 4, Episode 16 Business Report.
Slava Ukraini, Heroyam Slava, glory to Ukraine, glory to heroes. I guess the most publicized story of the past week involves the leak of U.S. security data about Ukraine and other situations. Understanding most of what's going on in that document's way over my pay grade, but I do hope that we and the West continue to provide the air power that Ukraine needs to stay strong in the air and in the war. Slava Ukraini.
150K is officially in the rearview mirror.
Around 10 p.m. last Friday night, April 7th, we crossed the 150,000 download plateau I've been talking about for the past few weeks. As happens frequently, someone downloaded 7 episodes or conversations at the same time, taking our total from 149,995 to 150,002. I think we're up to about 150,500 as I speak right now. Thanks to all of you for getting us to a place we frankly never, ever envisioned we'd be when we started 3 years ago.
And, speaking of 3 years ago,
our third birthday recording is next week. We've begun posting information online about our celebration games. 2 are pretty clear. The third is what I've referred to in a past podcast as the Mike Wilson drinking game. Mike has listened to every episode since Season 1, Episode 14, and has compiled a list of phrases and words he associates with each surfer. This contest is to see who can match the single word or phrases that he chose for Jörn, Louise, and me. To compete, send answers to us through the Lightgate enrollment process or straight away to questions@surfingnash.com. The prize is 3 bags of specialty health coffee that my household swears by. It has 2 special mushroom ingredients, lion's mane and chaga, and a really nice flavor. It's appropriate for a drinking game because it's got lots of caffeine and no alcohol. The winner of each of our contests, the drinking game phrases is 1, and check out our ads to learn the other 2, will win coffee. The composite winner, who does best on all 3, is in line for a special prize I'll be announcing via ads and email later in the week. And by the way, because we got to get ready for the party, this is going to be a short business section.
This week's Vault looks back to #NASHday 2022's wrap-up episode.
Our Vault episode this week, Season 3, Episode 29.1, comes from our wrap-up conversation for NASH Day 22, wherein Jeff McIntyre interviewed Jörn, Louise, and me, kind of flipping the script. This conversation focuses on the unique value that #NASHday, a global patient-focused virtual event, brings to the entire extended fatty liver community and how it is different from other meetings. And with that, I'm off for another week to get ready for our birthday party. Thanks to Jake, Magic Mike, Steve, Eric for helping us get this episode out the door. Next week, join our party. And until then, make sure to let us know how you feel about Rising Tide. Don't forget to send reviews. Stay safe. Surf on. We'll see you next week on the podcast. Bye-bye now.
Have any questions for the surfers? You can send them to surfingnash.com, and we will answer on the podcast or the website.